Hi, hello. Welcome back. So today, we are going to talk about the skeletal system, the bones, and we in my earlier lecture we give you an overview about how to describe, how to understand the bones. With this one, we are going to learn to identify those major bones, and we will give this lecture in probably two portion. The first one we will focus on the axial portion, and the other one is to focus on the appendicular portion. So let's get started. Let me see my screen. All right, that's this one. I think so. All right, so you can see here is the PowerPoint slide. And so we are going to look into the major bones of the axial system. So this is our skeletal system, all of our bones. And you can see that this one presented in two color and the two side. So this is called the anterior view, seen from the front. This is a posterior view, seen from the back. And you can see two color. This lighter color is the axial skeleton. This greener color is the appendicular skeleton. And so we will first look into the axial. And so this one is also the bones that um, directly attached to our the structure that protect our central nervous system. So here we have the brain, this one, we have the spinal cord. So brain, spinal cord, and the bone attached to that directly are the axial. Yeah. So pelvic girdle connect with the spinal cord, but this one consider the appendicular. So it's like borderline, right? It's like between the thoracic cage, right? This is a thoracic cage, ribs. This one attached to the spinal cord, but it also attached to the it doesn't attach to the arm. This one does attach to the arm. So so we will look into this one. So basically, we will start by looking at the axial, sorry, the skull. Skull include the cranial and the facial. And then this one is the spinal cord. Spinal cord has a cervical portion, thoracic portion, lumbar, sacral. And so this is a vertebral column, spinal cord, vertebral column. And then here is the thoracic cavity. We learned about the thoracic cavity in our earlier lecture. And this is the bone to form that cavity. Um, so the bones are the ribs. We have 12 pairs of the ribs. So those are the ribs. And then that's it, you know. So Axial is probably very easy. You will see that things is getting harder and harder, or more difficult, and so this one is pretty easy. Axial, like head, spinal cord, ribs. So if I give you this picture for identification, axial portion probably easiest one. We later will talk about the appendicular, so it has more bone, so it's getting more detail more things to memorize. Yeah. So let's start from the first one, skull. Skull has a cranial and facial. So you can see this is basically see in the front is facial. Those have groin inside is the cranial. So skull has cranial facial. There are some other bone, actually not a lot. We have hyoid here. We have three small bones in the inner ear, three in each side, so six auditory uh, ossicles. So that's that. Don't school includes cranial bones and facial bones. So don't need to worry too much about the number. I'm not going to quiz you on how many bones. You know, it's I feel that remember those numbers is You may miss one, miss two, you know, but memorize the number of bones is not necessary. Okay. All you need to you should put your focus on able to identify it. Yeah. So let's learn how to identify it. So here, score, you have the facial portion. So why do we separate facial and cranial? Cranial are the one to protect our brain. So our brain is right here, and then uh, brain stem here, and then spinal cord. When it leave the skull, is going to be the spinal cord. Vertebral column protect the spinal cord. Facial does not protect our brain. Facial give you the facial expression and the several like provide the structure for a lot of the sensory system like visual sensory, auditory sensory, the test, right? The to test your food, those sensory. Yeah, smelling, smell sensory. So those are the facial portion. All right, so facial, we have, so here is the identification. I will give you this picture and ask you to identify it. You have nasal bone, you have the maxilla, you have the zygomatic. This one is vomer. This one is in the nasal. It's very middle. So this one is more like lateral. Maxilla, the top of your mouth. Mandible, the bottom of your mouth. So right? Your maxilla, your mandible, very obvious. Nasal, zygomatic. So those are the key major bone. And down your cranial, you have the frontal, parietal, occipital, temporal. So those are the major bone. When we learn later, we will use the same name for our brain region. Frontal, occipital, occipital, parietal, temporal. So those are the major one. We also have some smaller one, the sphenoid, and also ethmoid. So you can see that these bones, temporal, you have pair, one side, one on the one side, the other one is on the other side. Parietal, you also have two, because here you have a sagittal sulcus, separate it, parietal. So you can see that parietal, you have two, temporal, you have two, the other one, you have one. Frontal, you have only one. Occipital, you also have one. This ethmoid and the sphenoid is in the middle of your bone. So you only have one. You don't really get to appreciate too much about their feature because they are very much like in the middle of your skull. Your skull protect your brain, right? And so in the middle of it, you have this sphenoid. Sphenoid is like meaning like bird or like bat. Ethmoid is a little bit like strange structure, but it is structured inside of your cranial. In the bottom here, before basically bottom here, you have the hyoid. This is the bone that's not connect with the other bone, but it connect with a lot of muscle. And the three bones in one ear, three bones in another ear. These auditory obstacles. Yeah. So that's that. All right. So let's look into one. So cranial bone is probably the easiest one to know. Pretty large, easy to identify. So let's look at the cranial. So cranial bone, oh, entire bone. So that's okay. Let's look at the everything. So let's look at cranial bone first. So I will show you this picture, ask you to identify. So you should be able to identify. Key thing you need to know is that we are talking about the bones. We are also talking about the suture because these bones, the bone in the cranial do not do not move, do not have the joint, movable joint. So their connection is called suture, basically pretty tight, connect to each other. It's not movable. Um, and so we are going to also learn about that. So let's start from the bone first. Frontal, parietal, occipital, temporal. So that's very easy. Then this one is a sphygmoid. And then we have the facial bone. Also, the other one here is ethmoid. So those are the cranial. Now we have the facial bone, the zygomatic, nasal, maxilla, the mandible. So also pretty easy, right? Yeah, pretty easy. So identify bone is pretty easy. And then these bones have the suture. So we are looking at the coronal suture, coronal side. This one is called squam, squamous suture from here to here. This one is the rhomboid, right here, rhomboid, right here, rhomboid suture. Yeah, so that's that. We will see more suture if we look at the superior view. So if we look at the superior view, we can see this is the coronary that we just talked about. This one is the sagittal. You can see that this is like zigzag like suture. Sagittal, and then this one is the rhomboid, right? And here is the bone, frontal, parietal, occipital. Yeah. We can also compare the adult suture versus the infant, baby younger than 1 year old. You can see they are not entirely sutured up yet. So it's still quite opening, so it allows brain to grow, so it has space. Otherwise, our skull is fixed, so there's no room for brain to grow. This one still have the room for brain to grow, and then bone will suture together when they grow up. The major difference is that the frontal, you can see here the frontal. In the frontal, baby has the frontal suture, but in adults, we don't have it. And other than that, we have a very wide open of this suture. They basically has not suture up yet. You have the anterior fontanelle, and also posterior fontanelle. Yeah, so those are the more opening space in the infant. So that's a suture. And then going back, here is a bregma. Sometimes people mention about that. That's a junction between the frontal and the sagittal suture. After talking about the suture, let's look at some other feature of the bone. So in our bone, it's very much like seal up everything, but they still present with some holes allowed nerve and the blood vessel to go through. So let's look at those features and some other features as well. So let's look at that feature. So so what feature do we see here? Here, the first one feature here. This one is called supraoptic foramen. So foramen means horse. So supra means above. Orbital is the eye is the orbital. So you have the supraorbital, and then down here, you have the infraorbital foramen. And this is we have this like connection. This connection is the zygomatic arch of the temporal bone right here. Zygomatic arch, zygomatic process. This is zygomatic arch entirely. Zygomatic process of the temporal bone, and this one is called the temporal process of the zygomatic bone. So that's that important feature. If you touch it, you can see that bone right there. Yeah. And then down here, that's your mouth. Then this one here, in your mandible, you have the mental foramen. So this foramen basically allow nerve to coming out. So he's still bone, right? But your facial still feel it. You have the feeling, right? So this sensory nerve will going through these holes and then transmit that sensor into your brain. Yeah, mental foramen. So that's that. And then mandible, you have this process. This process, it doesn't identify it here, but it's another process. This one is the coronoid process. Uh, we are going to look more of this process in our lab when we have this brain model in front of us. So that's that. In our eye, you have the lacrimal bones, and here you have a little bit like dented area to allow the lacrimal uh, gland to sit inside. Uh, so that's called lacrimal groove right here. And then in the temporal portion, we have this acoustic, external acoustic, meaning that it's music, right? It's sound, acoustic mutus, or sometimes we call it acoustic canal. It transmits the sound into your brain. We have this temporal bone, we have some process. This one, very sharp one, is called styloid process. This non so sharp one is called mastoid process. This mastoid process connect with multiple muscles. So allow your movement of your neck, actually, neck movement. It pull your head and to control your head and your neck. This styloid will connect with the hyoid, and so it allow your to control your swallowing. All this muscle in your uh, on the floor of your mouth control your swallowing, and so those muscles connect with the stylus and the hyoid. And so that's that. This one temporal portion, you have temporal line. You can see two. If you see two, one is called superior, the upper one is called inferior. So terminology is pretty easy. It's just compound, uh, superior, inferior, and those are temporal. Yeah. So we talked about this one already. So that's that. Then here is the suture again. So you know the suture, and then you know the difference between adults and the infant. So that's that. Pretty easy. All right. Look at the front. A lot of those are already repeated, but we can go over those again. So basically, two things. One is to identify the bones. The other one is to know those uh, features of the bones. So for example, frontal bone, nasal bone, uh, maxilla, the zygomatic, the temporal, parietal, right here, mandible. So bone is pretty easy. This is the vomer, so it's down there, but more interior. Yeah. And here we have the nasal cavity. We'll learn more about that. This is called concave. We have three concave. We have the superior concave, inferior concave, medial concave. It doesn't show the superior here, but we have the superior one, middle one, inferior one. Yeah, so to allow some more surface area to warm up the air going into our nose. So let's look at the feature. Supraorbital foramen, we talk about that. Infraorbital foramen, we talk about that. Mental foramen, we talk about that. Yeah. There are, what else do we talk about? Are we going to talk about? So this is the eye, so it's pretty big. Eye has three major holes. This one is called optic canal. This one allow the optic nerve to going through. So vision signal going through these holes, this optic canal. You have two fissures. One is superior orbital fissure. The other one is inferior orbital fissure. This one is not for the vision. Then what is this for? These two are for the this one is for the eyeball movement. So you have a nerve sitting out here. So this one is coming in, like sensory signal coming in. As for this one is to signal coming out to control your eyeball movement. So you have the ocular motor nerve, several other nerve to control your eye movement. And this one is the uh, inferior orbital feature is for another basically nerve coming out of it. So that's the eyeball, the orbital like a cavity. Yeah. So that's that. I think that's about it. Yeah, I think that's about it. Let's look at this one here. Yeah, so we cover everything here already. Here is a suture. That's the frontal nasal suture, nasal bones, ethmoid, lacrimal. So our eyeball are formed by multiple bone. We have the frontal bone, zygomatic, uh, sphygmoid. I hope it's saying here. Right here, yeah, sphygmoid. Yeah, so this purple thing is sphygmoid. And then ethmoid, and then lacrimal. So those form our eye socket. And then concyle, yeah. This is the uh, uh, a structure of the ethmoid. So our ethmoid is very much in the middle of our or central of our skull right here. So you look at this green thing, this green thing. This green is an ethmoid. Yeah. So where is that ethmoid? Ethmoid right here. So so those are the ethmoids, very much like sit in the middle of your behind your nose and underneath your brain. So those region. Yeah. This one is called this chin here is called mental protuberance. Mental protuberance. This one also connect with multiple muscles attached to it. So that is the feature of the facial portion. Yeah. And we can also look from the bottom. So we look at the top, and then here is the bottom. So from the bottom, you see a lot of bone structure that you don't see, particularly those in the middle portion, in the middle and in the bottom of the brain. So those are the palatine, a very small bone, is sit uh, in the top of your oral cavity right here to kind of patch on it. Nasal bone, oh sorry, nasal bone is not here. Nasal bone is here. Nasal bone is you know vomer right here. Vomer right here. Right here, right? Vomer right here. So palatine and the vomer basically form the bottom of your nasal and the top of your mouth. So that's the floor between nasal and your mouth. So that's the important one. Here you can also see the beautiful sphygnoid right here, like butterfly shape. Yeah. Here you don't get to see ethmoid because ethmoid is above that. Ethmoid here. This is ethmoid right here. Yeah. But what we are seeing is here in this level. You can also see this is the occipital. So from the occipital, you can see that it starts to anchor or laying on your spinal column, vertebral column. So you have this uh, occipital condyle, like two of these foot to sit on your spinal column. And this is the temporal bone. Here you can see this is a stylus process. This one is the mastoid. You don't get to appreciate how they orient. You see better with this one here. This one, styloid and the mastoid. So that's that. Furthermore, there are some key holes that you need to know. This big one is the one that your brain will connect with the spinal cord. This one is in the occipital bone. This one is called foramen magnum. Yeah. Occipital bone also have some feature right here. You have the occipital protuberance. This one is the occipital, sorry, superior neutral line. Basically allow your skin like and also back muscle to attach to it. But talking about the hole, this is a important one, foramen magnum. And then in the temporal bone, we have two major holes here. These two major holes are jugular foramen, jugular foramen right here. And this is the this one allow the jugular nerve, jugular uh, uh, vagus nerve to go through jugular foramen. And this one is the uh, carotid. This one important because this one allow actually carotid artery. This one is going to provide the blood vessel into your brain. Between the occipital and the temporal, we have this one. This one is called the foramen descendens. And in the sphygnoid also provide us with several uh, holes. One of them is the foramen oval. And then, yeah, here are some other holes. This one is called greater palatine foramen, and this one is an incisive fossa. So that is the bottom of it. And we are going to put a little bit of time talking about this one here. This one is called the sphenoid. Yeah, so here is, when we look at it, we look at from the, if we open up our skull, we can open up our skull in using our model in our lab. We can see the bottom of it. You can see here is a frontal. All right, sorry about. I was checking in my email. All right, so let me double check. All right, still recording. Nice. All right, so yeah, so here is the frontal portion. This one is the uh ethmoid. Then this one is the sphenoid. So you can see sphenoid actually provides us with many like important structure. So you have the three holes in each side. You have this one is the optic canal. It connect with the vision. This one is the uh, foramen ovum, and this one is the foramen lacerum. So they allow, and this is smaller one right here. This is a foramen spinosum. So this four on each side. And you can see that sphenoid is very much like a bat. It has this bat has wings, so we call this one a laser wing right here. The laser wing. It doesn't say here, but we were looking into that in our lab. This one is a greater wing. This region allow our pituitary gland to sit in it. So this one is called sella turcica. So right here, yeah. And this one is the temporal bone. Temporal bone, you have the uh, down here, this one here, you have the carotid canal. This one is internal acoustic, so the sound going from the into your brain through the internal acoustic meatus. This is the jugular. Jugular allow jugular vein. That's what I thought earlier. It doesn't really say here. I was like, man, really? Jugular actually allow jugular vein to go through. Yeah. So that's that. This one, closer to the like inner surface, you can see this hole. This hole is hypoglossal. This one allow hypoglossal nerve, cranial nerve 10. So this number here are associated with the cranial nerve. We have 12 pairs of the cranial nerve 10. Sorry, cranial nerve 12 go through this one. The last cranial nerve, hypoglossal. Yeah. So that's that. And so here is a sphenoid. Um, I want to just get your attention on the beautiful structure of it. This is from the superior view. So you open it right here. You open it and you present this one. Open your skull. You present this one, and you can see it's here. So you can see that it has a this one is called a lesser wing. This one is a greater wing. So it has a wing. Lesser wing is on the top level. Greater wing is on the lower level. On each side, you also have a 5 holes. You have the optic canal to connect with the vision. Between lesser wing and greater wing, you have this one here, superior orbital feature. This one is the foramen rotundum. This one is the foramen ovum, and this one is the foramen spinosum. Yeah, so that is, and down here you have the sella turcica, that where you have the pituitary gland to sit on it, and these sella turcica has two border. One is the tuberculum sella, and the other one is the dorsum sella. to sit on it. Yeah. So that's that. All right. So sphygmoid, you can also view it from the anterior side, anterior view. So you can see another way to get that. You can appreciate its butterfly structure, and it also provides some more process to form your cranial structure, such as the sphygmoid sinus right here. This is the superior orbital feature. We don't see it in this view. Oh, you do see it. Yeah, superior feature, superior orbital feature right here. And then the process. We have two processes going down. You have the middle thyroid plate and the later thyroid P. We don't spell it out. You don't pronounce it out. Later pterygoid plate. Yeah, so that's that. Another bone that we also will pay attention on it is the is the mandible. So mandible, you have uh provide the 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 lower part of your oral structure, oral cavity, yeah. And then it's like U shape. This U shape is called the body of mandible. And then it has two process. This process, the front one, the front one is called coronoid. The later one, the back one, is called condylar process. So the condylar actually attached to this condylar fossa of the temporal bone. Yeah, I don't know if we mentioned about it here. Let me see that. Yeah, it doesn't really mention it here. Yeah, so this one is attached to this condylar fossa of the temporal bone. Right, so that's that right here, condylar. Yeah, and so that is the important feature. We are also going to look at those in the lab. This one is called the ramus. This one is the angle of the mandible. We have the horse in the front. This is mental foramen. The teeth. Here is a line. The line is called mylohyoid. So hyoid is another bone, and the mylohyoid is the muscle attached to this line. We also have this like a protrusion for each tooth, and so this is called alveolar uh, part. Yeah, alveolar part of this to allow tooth root to enter to it. So that's that. If we look at the inner portion like that here, you can see this is a line, mylohyoid line. I think it's right here, mylohyoid line right here. And then here is another foramen. And so this foramen is called mandibular foramen. It's inside. So the mandibular foramen, nerve coming in, and then nerve coming in, and then coming out from the other side. So there is a tunnel inside of the bone, coming in and coming out, coming in and coming out. Yeah, so the nerve can coming out to your lower part of your facial. That's that. Another bone is called the hyoid. It's underneath our basically the mouth, right before our vocal cord. And this one does not attach to any other bone, but it serves as the structure to anchor some other muscles. So we have the hyoid. Above that we have several muscle. Underneath that we also have several muscle. You can see hyoid has the ligament. This is the thyroid cartilage. This one allows the thyroid gland to sit on it. And then yeah, so this is the hyoid. Hyoid has muscle attached to our mandible. This we are going to talk more muscle in the next lecture, but this one show you the digastric muscle. We talk about two muscle actually. I hope we may probably mention that, but here it show you digastric, meaning that it has two gastric. Gastric means stomach, so or belly, right? So digastric means two gastric, one gastric, two gastric. So digastric, basically just hang this bone there. It's very important one. Mylohyoid is another one, but it doesn't really say it here. Digastric. This one, what's this one? Stylo. Okay, this one connect with the stylus, stylohyoid. Yeah. But here, mylohyoid is also another muscle that connect with here. Yeah. So that's that. So it show you that it's underneath here. Stylo process from the temporal bone. Mastoid from the temporal bone provide the attachment. The hyoid is like U shape again. Yes, the body and the two horn, lesser horn, greater horns. Yeah. So just show you the like side view of it, give you the idea where it is. So it's right underneath our mandible, right underneath there. And it basically serves the function for controlling this muscle uh, to control our swallowing. Yeah, it basically is the primary function. And also with that one, we can also use it to control our chewing, swallowing, and also talking, making the note, making the sound, making different kind of sound. Yeah. So this one show you the muscle that attached to it, stylo, hyoid, uh, sternal connect to sternal. Stylo is right here. This one is the suprahyoid. So suprahyoids basically are all these. These are suprahyoid muscle. And so when it control our chewing, swallowing, yeah. This picture it just give you the idea of where it located when you see the side view. Yeah. So that's that. Uh, then the next thing is about the vertebral right here. So for the vertebral, what you need to know is that it's a sequential bones, one next to the other, next to the other. And what do you need to know? Actually, with this one, you kind of need to know the number, the amount. We have a cervical portion of the vertebral uh, column, cervical, thoracic, cervical is C. It's because this is very common. C1 to C7, T1 to T12. So it's very common for the doctor to describe the location based on the number of the vertebra. So say C1 region, C6 region, C7 region, etc. So you kind of need to know the number. Cervical, you have 7 cervical. Thoracic, you have 12 because we have 12 ribs. Lumbar, 5. Sacral is a fused bone, so it has several, but they all fuse together. In the end, we have the coccyx. Coccyx. It says coccygeal, but you can also find coccyx. COOCYX. Yeah. So that's that. So you have these bones. So I summarize here. 7 cervical, 12 thoracic, 5 lumbar, sacral or sacrum, coccyx. Yeah. And they also present, if you look at the sagittal view, you can see it has the unique curve. Cervical, thoracic, lumbar, sacral. So yes, this unique curve. Yeah, so that's what you need to know. So what you need to know are the amount of the bone, the number of the bones, and their curvature. Another thing that you also need to know is that each bone has its feature. So you can see that each bone, vertebral column structure, each bone has its feature. It has one body right here. One body. There are some variation from the top to the bottom, but they will more or less have these features. It just present in a little bit different way. So it has the body. So this body allow bone to lay on each other. And between the body, we have this cartilage to absorb the pressure. It's called disc. We are not talking about it here, but it's absorbed. So between bodies. So we have the body, and the body, it forms the like arch. Where is that? Here, arch. It forms the arch. This arch form this hole. This hole allow nerve to go through. So the nerve coming through these holes. Nerve comes through this hole. So here is the disc. All right. Finally, I see the disc. So nerve comes through this hole. Nerve comes through this hole. So that's where you have the nerve. Nerve comes through this hole. And so you have the arch. The arch attached to 5 process. You have one spine process. Where is that? Let me see it here. Here, this one. Spinous process. You have one spinous process. So it's one. You have 2 transverse process right here. Let me see here. 2 transverse process like here, lateral side. And then you have 2 arcuate process. One is a superior arcuate process, the other one is inferior arcuate. So totally, let me just correct my counting. You have 1 spine, 2 transverse, so left and right, 2 arcuate, 2 superior arcuate, and the 2 inferior arcuate. So you have 7 spines actually, 7 process from that arch. Yeah, so that's what you need to know. So here showing you that spinous process, transverse process, superior arcuate, inferior arcuate. This superior arcuate, inferior arcuate will attach on the neighboring spinal vertebra. Yeah. So that's that. Nerve comes through this vertebral foramen. The vertebra join to the neighbor vertebra by the disc. Disc is the one to lay between the body. The superior arcuate process will join or uh, will join the inferior arcuate process from the neighboring spinal column, spinal vertebra. Yeah, so that's that. All right, so that's all you need to know, and I summarize it here. Each vertebra, peroid vertebrae, has a common structure. Each one has a body. It has the arch, 7 process, 1 spinous process, paired, meaning 2, transverse process. You also have 2 arcuate process. Yeah, so that's that. Sorry, 2 superior arcuate and the 2 inferior arcuating process. Yeah. The last thing is the thoracic cage. So from the thoracic cage, what you need to know is um, you have the ribs. You have 12 pair of ribs. Each one anchor on the vertebra, thoracic vertebra, T1 to T12. So you have rib 1 to rib 12. This is posterior view, so you can see the vertebra. But not all the ribs anchor into the front. What do we have in the front? In the front, we have the bone called sternum. So this is the sternum in the front. All the ribs join to the front, but not all. All ribs join to the vertebra, but not everyone join the front. You can see that 11 and 12 do not join. This vertebra has some structure. This one is called the uh, manubrium. This is a angle of our sternum. This is the body, and then in the end here we have a process called uh, xiphoid process. Yeah. As for the ribs, when they join to these uh, sternum, they join by this is the cartilage right here, costal cartilage. So rib 1 to rib 7 directly join the sternum. 8, 9, 10 will fuse and then join with the 7 to the sternum. 11, 12 do not. So we call the 11, 12 the floating rib. We call 1 to 7 right here. 1 to 7 the true rib because they directly join the sternum. And then 8 to 12 are called false rib because they do not directly individually. Individually. 11, 12 do not connect with the sternum at all. Yeah, so that's called the false rib. So that's the structure. Here we have the clavicle bone. In the back, we have the scapula. Scapula has a process. We will talk more about scapula in the lab. One process is called acromion. The other process is called coracoid. And this is the glenoid. This is forming the shoulder joints with your arm. So that's that. That's thoracic cage. So here just show you some feature of the ribs. 1 to 7 true ribs, 8 to 12 false rib, 14 rib, 11, 12. Rib has all of them connect with the spinal column, and the other end connect with the sternum through the costal cartilage. Yeah. So you can see that this is the structure. You see this portion, you have the tubercle, you have the head. This one connect with the spinal column. And then the other end connect with the cartilage. So your rib can move. And yeah, so that's it. All right, let me know if you have any questions. Let me stop sharing. Bye bye. See you next time.